Hello, this is Dr. Nettleman bringing you For Your Health again. We have today the privilege of having Dr. Holly Thomas, and Holly is the South Region Medical Director of Atrius Health. And even though you've been in Braintree for many years, I think Atrius Health and Harvard Vanguard is not too familiar to a lot of residents in the town. And I would like you to, if you would, please introduce yourself, tell us a little bit about yourself, and take it from there.
Thank you. So, as you already mentioned, I am Atrius Health is divided into two regions, the North and the South, and so I am the medical director for the South region. And so it's my responsibility to help coordinate care, to work with our outside partners to make sure that we get the best quality care for our patients when they are being seen at hospitals and things like that, and to put together a comprehensive system of care for our patients in the South region that makes sure they have access to the specialists and the care that they might need depending on what's going on with them, and to help to figure out where there may be gaps and ways to make sure that everything is available. So,
could you give us a little bit of history of Atrius?
Sure.
Atrius. Is it Atrius or Atrius Health?
Atrius Health.
Atrius Health.
Yeah. So Atrius Health came together was a group of individual practices that were like-minded in terms of wellness and quality and evidence-based medicine being their philosophy of care. And so they have roots that go way back more than almost 50 years. In 1969, Harvard Community Health Plan was founded by some Harvard Medical School physicians who wanted to develop a better model for caring for patients. They could already see that healthcare costs were going to become an issue for the society, which has come true, and that there was probably a better way, and part of that better way is to keep people well. You know, historically, it was very much a system that treated sickness, and part of that may have been that there wasn't a lot of information about how to keep people well, perhaps, but they felt like if people were connected to their doctor, if they had access, easy access, inexpensive access, frequent access, that we could do a better job of caring for them. It's interesting to note that Don Berwick, who went on to be a real leader in terms of quality in healthcare, was one of those physicians. And so at Harvard Community Health Plan, there was an early emphasis on self-monitoring of the quality of the care that you deliver, and for trying to make sure that your care is evidence-based, which is an important concept. And so we actually now, medicine as a profession is very monitored for quality. Many of the insurance companies have their various programs that have been called pay for performance in one way or another. But we at Atrius Health actually monitor more quality metrics than we are required to, and we will always choose a new one each year to say, now this is something that we're going to focus on, even before the other outside agencies and things might choose this as a metric. And that goes all the way back to when Don Berwick was noticing that we needed to pay attention to our quality. So the concept of taking care of the patient, the total patient, caring about them even when they're not in front of us sick goes way back. And the concept of holding ourselves to a high standard of quality and evidence-based medicine goes way back. And the other groups that came together to form Atrius Health also have a rich history of the same philosophy. I am more familiar with the Harvard Community Health Plan history because it eventually evolved into Harvard Vanguard Medical Associates, which is the group that I was part of before it became, part of Atrius Health. But Dedham Medical, Granite Medical, they also are very invested in caring for people, keeping them well, and delivering high-quality evidence-based medicine. So.
Okay, you've used that term evidence-based medicine 4 times.
It's an important term.
It's important. Could you tell us just what does that mean?
So evidence-based medicine means that you are doing the things that have been shown to be important and effective through rigorous scientific research. It's important because if you don't do things that have been shown to be important, you may not be providing the best care for your patient. It's also important because if you are doing things that haven't been shown to be worthwhile, you could be spending healthcare dollars that aren't really being used in a value-based way, or perhaps you could be subjecting your patient to unexpected side effects. One of the things that people don't realize is that a lot of testing is not completely benign, in that there can be side effects in terms of false positives that then create anxiety and further testing. There can be a test that is not indicated but perhaps introduces something into your system that you're allergic to. You could have had a bad outcome or a problem that was purely the result of being subjected to a test that wasn't shown to be the right test in the first place. So evidence-based medicine is important both from make sure the patient gets what they really need, what has been shown to be really effective, and don't put them at risk for unexpected side effects because you do something that hasn't been proven to be effective.
Would you say that the use of the HPV vaccine, the human papillomavirus vaccine, as a routine immunization is based on evidence-based recommendation?
Absolutely,
Yes.
Absolutely. If all vaccines are very evidence-based, and the risks are minuscule compared to the benefits. And we don't always have the luxury of having something that is so obviously beneficial compared to the risks. I mean, when we know, for example, that if people don't control their blood pressure, they will have something bad happen to them someday. But the medications also have side effects.
Statistically speaking.
Statistically speaking,
Right.
Yes. I mean, and then you also get into the concept of these guidelines are based on studying populations, and you're dealing with individuals, and so you have to sort out those parameters and what are the aspects of your patient that makes them a unique individual, and how does that influence your choice of whether or not to go with the guidelines. And of course, patient choice is important. Patient philosophy is important. But it is very good to have as much information as possible about the risks versus the benefits when you're going to recommend something to someone and they're going to take your word on it.
How large is Atrius Health? You mentioned that you're the South Region Director.
Yeah, so geographically, we stretch from south of Boston. If you look at the zip codes of patients who come to Atrius Health, We have patients even from the Cape that will come up and get their care with Atrius Health. We go quite a bit north of the city, Peabody, Lynn, and we stretch west, at least out to 128 and a little bit beyond. We care for about 500,000 patients, and we have a large group of primary care providers, and then an excellent group, not to say that the primary care providers aren't excellent, but an excellent group of specialists, all of whom use the same electronic health record. And this is part of the philosophy of caring for the patient, the total patient, whether or not they're sitting in front of you, is this network that we have created of people who are connected to each other so that there is a almost flawless flow of information about the patient. There's a lot of the unacceptable things that happen in medicine occur when patients transition from one provider or one system of care into another, and all of the information doesn't necessarily follow them accurately or in a timely manner. So by creating this network, this team of people that can actually completely surround the patient in sort of a 360 network of care, that all have access to the same electronic health record, it allows us to do a much better job making sure that our patients are well cared for and safe. This is one of the reasons why we have our own VNA, because they can go into the home and see the record, the primary care notes and the specialty notes. Our hospital partners our preferred hospital partners can read our Epic. They can't write into Epic, but they can read our Epic notes, and so it definitely makes it much safer for the patients.
And the Epic is the communication, so there's constant communication available, whether it be referrals or the like. What hospitals are involved with Atrius?
We have our preferred partner for tertiary care is the Beth Israel Deaconess Medical Center. And so in the South region, of course, we have the Beth Israel Deaconess at Milton and at Needham and
Jordan.
And Plymouth.
Yeah,
yep. Plymouth. And so and we have a very close relationship with them for tertiary care. And then other, South Shore Hospital is a community hospital that we have a close relationship with. In the north, they have relationships with Lowell and Winchester, and I'm not as familiar with the hospitals in the north, but they also have relationships with community hospitals. Keeping patients in their community is an important part of taking care of them, and one of the things that we're doing, when Atrius Health was officially legally formed as its own entity, one of the things we established was an innovation center. And the vision statement of Atrius Health is that we're transforming care to improve lives. And our innovation center is one of the ways in which we're sort of, walking the walk as well as talking the talk. So this is a group of physicians and engineers and care improvement experts that are constantly looking at issues and trying to develop better ways to deliver care. So for example, we have launched what we call our Care in Place program. And so this is an opportunity when a patient calls and they probably need to be seen today, but for whatever reason, transportation is an issue, or they don't quite feel like getting into the office, we have the capacity to send clinicians into their home directly. And this allows us, first of all, to keep them at home, and secondly, to keep them out of the hospital as much as possible. Hospitals are fantastic places for really, really sick people, but they are not the best place for everyone. There are germs. There's a lot of reasons why, if what's going on with you could be cared for in a more community setting or your home, is probably going to be the best thing for you. So our Care in Place program is excellent because a clinician goes in and evaluates the patient. We had a patient that had fallen, and so we sent the clinician in. They did an exam. It seemed like there was nothing broken, but we were able to get mobile x-ray to come into the patient's house and take the x-ray. It showed that there was nothing broken. So then we were able to mobilize physical therapy to go directly in to work with the patient until they were doing well enough then to get up and walk around on their own and get back. And so, that patient probably had a better experience and probably fewer complications because she was able to stay at home. And so, this is just one example of something that we're doing that I think is transforming care to improve lives. We're also going to be launching telemedicine for urgent care soon. The Innovation Center has worked on a protocol for which sorts of complaints would be appropriate for a telemedicine visit. We'll do a pilot with a few providers. We'll work the bugs out of it, and then we'll make it available to our general population. Because if we can be the person that always delivers your care, then we can always make sure that your record is up to date. So one of the things that we really want to do is just be there for our patients all the time, because it's so much better for them if the people who always take care of them are the people who always take care of them. And to that end, we have telemedicine. So, telecommunication. Telemedicine was the pilot I just spoke about. And so when a patient calls 24 hours a day, 7 days a week, a clinician answers the phone, who can prescribe, can book an appointment for the next morning, could send the Care in Place people in to the home the next morning, could, or recommend, really you do need to go to the emergency room. But it's not a situation where you have to talk to someone who may or may not have a lot of medical knowledge and then wait for someone to call you back, because it's really important that we are there for our patients when we need them, so we can never let them down.
Well, let's say, for instance, in my case, at say 5 o'clock, the office is closed. What happens after 5 o'clock if someone calls, say, at 7:30? Who would they speak with then?
They would speak to one of our telecom nurse practitioners.
A nurse practitioner.
Usually, most of them are nurse practitioners.
Right.
And then they would do a detailed interview with the patient. They would, again, look in the patient's medical records, so they would be aware of any medical problems that the patient had. They will see the complete med list. They'll see the complete allergies. They'll have access to any recent laboratory data, any recent hospitalizations. And so based on the interview of the symptoms and the information that they get from the electronic health record, they could make a recommendation. So if you are a fairly healthy person with what sounds to be an uncomplicated urinary tract infection, you have no symptoms that make us concerned that you are more sick than that, they could make the decision to send a prescription for you in, and you'd be all set, you know. If on the other hand, based on their review of your record or based on the symptoms that you're complaining about, they really think that you should be seen before anything is done, but you don't sound so sick that you couldn't wait 10 hours, they would make sure you got in first thing the next morning. And if you sounded sicker, then they would recommend that you go to the emergency room. So it's a really convenient system for the patients.
Now, when you mention the emergency room, could you speak for a moment about the urgent care?
Well, I wanted to mention that. So you had said if they call at 7:30. So we actually do have urgent care 365 days a year. So when I speak about the emergency room, I'm thinking more in terms of people that are calling midnight to 7 a.m. because that is right now we don't provide care in our offices at that time. Although we're debating whether we should. I don't know how that decision will go, but we have several of our practice sites provide urgent care until 8, 9, 10 o'clock at night, depending on the location.
So here in Braintree, you have urgent care?
We have urgent care, which is staffed by emergency medicine trained physicians and clinicians. Mm-hmm. So we have a lab on site, we have x-ray on site, we have a pharmacy on site. And so, it's very convenient for the patient to be seen, get their testing done, and if a prescription is recommended, pick it up on the way out the building.
Now, could a patient go to urgent care just on their own, or do they have to be referred there by the nurse practitioner?
No, we accept walk-ins at any time of the day into our urgent care. Sometimes it's nice to get a heads up about the information that someone else has already, or calling can be good in case someone would say maybe you need something more than what urgent care offers, but we absolutely always take walk-ins anytime, and they're open Saturday and Sunday also.
You mentioned about the pharmacy. Could you tell us about the pharmacy that is at the Braintree site at Harvard Vanguard?
Yes, most of the previous Harvard Vanguard sites have a pharmacy, and we have a very rich pharmacy team. So we have clinical pharmacists that help evaluate medications, drug side effects. We have a P&T committee that reviews all medications and reviews the literature regarding the use, the effectiveness, the side effects, and they make recommendations to guide us in terms of which are the best medicines to choose for within any given category of medication. There's a lot of meds for cholesterol, there's a lot of meds for blood pressure, and especially when new medications come out, it's very useful to have their analysis, because sometimes they say, yes, this brand new expensive drug really is the best thing for your patient. And sometimes they say, well, preliminary data suggests that we should kind of wait on this because maybe there'll be more problems than they predicted, and some of the ones that are already in the market are just as good. And so we benefit tremendously from their help. The pharmacy itself, we contract to get the lowest cost for any of our over-the-counter medications and for our prescriptions. So the majority of our patients will pay far less for their prescriptions if they fill them in our pharmacy than they will if they go to CVS or some other pharmacy, because that's part of taking care of them, is not making them go poor.
And this would just be at the Harvard site, the pharmacy?
We're actually right now, Granite Medical doesn't have a pharmacy, but we are working to expand the sites that will have pharmacies.
Good.
We also have mail order, so you
So
can.
you do?
Yeah, we do. So you can just have them send you your prescriptions every month, every 3 months, whatever your insurance company will pay for. You can, and it's so much better. Again, these transitions of care and gaps. I mean, we get requests sometimes from pharmacies outside that have something on auto refill and the patient's medicine has been discontinued. And they just send the refill request automatically, even though the patient's not still taking the medication, which can result in mistakes. Again, our pharmacies are in our records. They communicate with us if they have any questions. And so it's another place where, you don't have gaps in your care because we try to do this.
Well, to summarize then, you would say that Atrius is particularly interested in quality care, evidence-based medicine, and those two things I'm sure go hand in hand.
Yeah. And wellness, and keeping people well. I mean,
keeping people well.
We didn't even talk about we have, diabetes education classes. We have meditation classes. We are, looking at every possible way to keep people well, because hospitals make money when people are sick, but we don't. We would much rather have people stay well.
Well, we had a bit of an agenda, but you can see how quickly the time goes. And we may have to have you back again to talk about all these other things.
No, I'd love to.
Well, that would be fine. And I thank you again, Dr. Thomas. It's been very informative, and I hope that the residents in Braintree have learned something about Atrius Health. And in closing, this is again Dr. Nettleman bringing you For Your Health, and I thank you for watching.